Hello, my name is Anna, and welcome to our channel. If you've been prescribed ADHD medication, you may have wondered what it's actually doing to your brain, not just what it's called, but how it works and why there are different types. Today, I'll explain ADHD medications in a simple, calm way. No medical jargon, no judgment, and no pressure. This isn't medical advice, it's just an explanation, so you can understand your treatment better. ADHD isn't about intelligence, it isn't about effort, and it isn't about willpower. At its core, ADHD is about how the brain regulates certain chemicals, especially dopamine and noradrenaline. These chemicals help with things like focusing, starting tasks, staying organized, controlling impulses, and regulating emotions. In ADHD, these signals are often too weak, poorly timed, or inconsistent. Medication doesn't add something artificial. It helps the brain use what it already has more effectively. There are two main types of ADHD medication: stimulants and non-stimulants. Neither is better. They simply work in different ways. Let's start with stimulant medications. The name can be misleading because in people with ADHD, they often have a calming effect. Stimulants increase the availability of dopamine and noradrenaline in the parts of the brain responsible for attention and self-control. This helps thoughts feel less scattered, distractions feel less loud, and tasks feel more manageable. Many patients describe it not as feeling energized, but as feeling clearer, quieter, or more settled. Stimulants also come in different forms. Some act quickly and wear off sooner, and others release slowly and last most of the day. This is why two people on the same medication can have very different experiences. Non-stimulant medications work differently. They don't cause rapid changes in dopamine. Instead, they work gradually, often by affecting noradrenaline pathways over time. They're often considered when stimulants cause side effects. Anxiety is present, sleep is affected, or stimulants aren't suitable. Non-stimulants can feel subtler, but for some people, they provide more stable, all-day support. Why ADHD medication can feel inconsistent? One of the most common questions patients ask is, why does my medication work some days and not others? This can depend on sleep, food, stress, hormones, timing, and even the day itself. This doesn't mean the medication has failed. It means the brain is complex and treatment is rarely perfectly linear. ADHD medication doesn't change who you are. It doesn't remove creativity, and it doesn't fix everything on its own. It's a tool, one part of managing ADHD, not a judgment and not a shortcut. If you'd like more simple explanations about ADHD and medication, you can follow for more.